to our episode of our podcast, and I'm here with
Bridget Magoba.
Bridget. Thank you for coming in. I don't want to waste time. Let's go straight to the first question of the day. What has been Sierra Leone to you, in your own way?
Yeah, Sierra Leone has been so amazing. It has been, um, it has been family. I've had a huge family, friends, and there's been a lot of learning, a lot of adventure, fun, and yeah, Sierra Leone has been so amazing and great to me. Yeah.
It takes us to our next question. What was the most fulfilling part of your work in Sierra Leone over the past 6 years? Because I know you have been here since 2019, so I don't know if you want to let us know that.
Yeah. I came to Sierra Leone in March 2019, and it's been 6 years as I speak today. 6 years or more, about a few months, and a lot has been fulfilling. I'm so proud that I've contributed to the development of the electronic surveillance systems in the country, and there's a lot of progress that has been made. The electronic surveillance system has changed from concept to reality. We've seen reality over time. We've witnessed the great things out of the electronic surveillance system during COVID outbreak, during other small outbreaks in the country, during the current mpox. It's really amazing that the country has really moved a step towards managing and controlling outbreaks um, countrywide. Then the other fulfilling thing is the capacity that has been built in digital systems has been tremendous. Um, Before the past 4 years, like 2019, 2020, um, there are a number of healthcare workers who could not even use any digital tools, like even a tablet, a computer, for reporting. And as I speak now, this is just a cup of tea for everyone because it's part of their usual work. So it's just so fulfilling to me that the country has really transformed the surveillance system to this level, and we are able to detect outbreaks on time. We're able to, through the reporting from the lower levels, we're able to use that data to make decisions and manage responses if there is an outbreak or even the routine surveillance management.
So I don't know if you have already answered part of the other question, which is very good. I don't know if you can describe the improvement right now in Sierra Leone as we're speaking.
Yeah, data quality, there's a tremendous improvement. Looking at the dimensions of data quality, there's more improved data completeness, comparing the aggregate data that is reported through the EIDSR and even the ECBDS. There's improved completeness, accuracy, and consistency. And during the EPRG meetings, there's been comparison of this information on a weekly basis. So it's also a way of managing and controlling the data quality coming from the data coming from the lower levels. Then, secondly, this data quality has been achieved because of routine monitoring, the checkups, feedback to the users so that they're able to know the challenge, the issues, the gaps that are within the system, which are corrected. It is very important to give feedback to users so that they're able to improve on the quality of data in the system. So basically, that is it. And the routine quarterly data quality assessments have been done. Also, these have supported and improved the data quality that comes in from the lower levels.
Thank you very much. We'll move to the next question, which is the most challenging aspects of your job and how do you deal with it here? Because I know you always fight
Yeah,
with these data people.
yeah, there are several challenges, including infrastructure. Infrastructure involves so many things. I mean, we need internet, we need the devices for reporting, they get damaged. But the most important, even besides before I go to the most important challenge, um, any implementation, the implementation has been quite costly, and unfortunately, most of the funding has been dependent on donors. So it's been challenging that if there is no funding from donors or from other partners, we are unable to perform the duties of the system and conduct whichever activities that need to be done as expected, including capacity building. But the biggest of all the challenges is introduction of parallel systems. With this introduction of parallel systems, it distorts um, the reporting flow and framework. And how this has been managed and resolved is that the NPHA, with support from several partners and the ICT department within the NPHA and informatics, we're working on integrating different systems. For example, if lab has a separate system, we can always pick the data from their system and it gets into ECBDS. If case management has a separate system, the same thing, IPC or whichever, they'll still use their separate parallel systems, but have the data pulled into a central place, which would be ECBDS in DHIS. Yeah.
All right, thank you very much. So let's try to wrap things up. So, what is the best piece of professional advice you have received so far in your
The best that I've received so far could be impact. For you to make an impact, it takes a longer time. And the impact is best realized when you're gone, when you're not there. For example, if I'm out of the system and the system is sustained, it doesn't break. Everything moves on as expected or as before, or even better. Then I will know the impact was made. Yeah.
So, any piece of advice from people, young people that are coming in now to the informatics world, the data world?
Yeah. One thing that I would advise the young people, I would just encourage them that data is so interesting. It's an interesting field. Health informatics is so interesting. There's a lot to learn. They need to be curious and ready to learn new things over time, because we're talking about technology. New things come up each day. So, and they have to be patient, because with this world, you're working with different people of different culture, different age group. So you really need to be patient, be able to work with people across different culture and different programs. For example, you'll be working with the lab uh, programs, you'll be working with case management, you'll even find yourself working in non-communicable diseases, etc. So you can easily find yourself working with a different category of people. So you need to be patient with them, need to, yeah, to be ready to learn and open up, because lots of changes happen over time. Yeah, I think that's the most important. And I would encourage ladies to join the health informatics and data sector, because it's over dominated by male, especially here in Sierra Leone. And yet, the women, we can also do it. Yeah.
All right, thank you very much.
Thank you.